Hi there, this is Kira Leslie with Debunking Addiction for HealthyPlace.com. Last week I wrote about some of the differences between behavioral addiction and substance addiction, or whether there was any difference, and that got me to thinking about how I choose to identify. I identify as being an alcoholic. I also identify as being an addict because, to me, being addicted to alcohol is another addiction to a substance. I often hear people refer to their disease or the disease of alcoholism. I know that the disease concept of alcoholism and addiction is a huge controversial topic, but it just got me to thinking about why I choose to identify as I do. I say I'm an addict and I refer to my addiction. I very rarely refer to my disease, although sometimes that slips in there, but usually it doesn't feel like the right choice for me. And I don't know exactly how to explain that because I've read a lot of different definitions of criteria for diseases, and there are a lot of things about addiction and about alcoholism that fit that criteria to me that make it seem as though it is accurate to describe it as a disease. But still, when I'm talking about it, I feel much more comfortable saying my addiction. I don't say when I was in my disease, I say when I was in my addiction. And I don't know if that's just a guilt thing still, that I feel guilty to put it in the same category as diabetes or cancer or leukemia or any sort of communicable disease. I don't know if that's the reason. I don't know if it's because perhaps disease feels a bit more medical, and I think of addiction as being not strictly medical, but also psychological and certainly spiritual for me as well. And yet I don't believe that I have control over it. I believe I have no control over my addiction. So I'm not 100% sure why I shy away from saying disease, but I do say addiction. And yet there are other things where I'm dependent on caffeine, for example. I know I am. If I don't drink caffeine in the morning, I get a bad headache, so that's caffeine withdrawal. And yet I don't really consider myself addicted to caffeine, because to me, addiction is something that's physical, spiritual, and psychological. And it also has some of those criteria from the DSM and from treatment, such as continuing to engage in behavior that you know will have negative consequences, and tolerance, and getting into trouble in your personal life or in your relationships or in school or work, which caffeine has done none of those things for me. So at this point I wouldn't say it's an addiction. But I think the concept of how people identify in recovery is really interesting. I hear people say, I don't identify as an addict. I hear them say, I used to be an addict. I hear them say, I'm a recovered addict. I hear them say, I'm an addict and I'll always be an addict. And I'd like to hear from the viewers and the readers to see how people choose to identify in relation to their experience with drugs and alcohol and behavioral addictions as well. And if you have any insight onto why you identify that way.